A lot of my colleagues in the media have been posting about the Lancet article that was published today, and the papers have been covering it as well. Now, the article is co-authored by Professor Martha Hickey at the University of Melbourne and Royal Women's Hospital and Dr. Lydia Brown from the University of Melbourne. Now, normally I never really have a rant on social media, and lots of things come around menopause, which yes, it frustrates me. But this article in particular has caused a lot of frustration. Now, whilst I do agree that menopause is a natural phase in life, it is a biological natural transition that women go through because we are cyclical transitional being, and it shouldn't be feared, and it's not all doom and gloom. I completely disagree with where this article is heading, that it's just basically saying to women, put up with it, suck it up. I'm Dr. Nighat Arif, an NHS GP that specialises in women's health, and I do menopause care as well. And as I go on into the article, it does say that doctors should consider women's lifestyle when they're going through perimenopause and menopausal symptoms, so such as sleep, alcohol intake and smoking, which can make symptoms worse, and also offer alternatives like cognitive behavioural therapy and hypnosis. And it actually downplays all the benefits of hormone replacement therapy. It actually even says that furthermore, appropriation of feminist narratives by commercial organizations which particularly position the use of menopausal hormonal replacement therapy as a way to empower women to regain control of their bodies while downplaying the risks endorses the framing of menopause as a disease. That's basically saying the more women that are talking about it on social media, like myself and celebrities that are out there, incredible women who are doing so much empowering work, are basically just making a massive noise about it because they're downplaying the risks of hormone replacement therapy, and it is something that isn't a disease. I don't think that I've been ever saying that menopause is a disease, and nobody from any of these commercial organizations are saying that it's a disease. All we are saying is that hormone replacement therapy is first-line therapy, and we need to give hormones back to women. And there is no way, and I've been working in the NHS, it'll be 17 years this August, that I wouldn't risk assess my patient very carefully. Not all of my patients are on hormone replacement therapy because I understand not everybody can have them or they choose not to have them. But actually, to say that it has minimal effect and overplay the side effects, this is based on data from the older hormone replacement therapy, so the synthetic versions, and it doesn't even take into consider the newer bioidentical hormones that we have. The article does make the distinction that there's no excess risk from vaginal estrogen. So for those women who have vaginal atrophy or genitourinary syndrome of the menopause, then vaginal estrogen is safe even if you've had a history of breast cancer. The patronizing thing is that somebody like me who works in the NHS, my clinics are full of patients who are wanting to have treatment for their menopausal symptoms. We know that 1 in 10 women consider leaving their job or do lose their job, and their relationships are impacted, their sex lives are impacting, the mood swings, the psychological symptoms, whereas this article is suggesting that cognitive behavioral therapy is a thing that you need in regards to managing your mood symptoms, which actually comes from a lens of real privilege, I believe, from the authors that have written this in the Lancet as well. Yes, I completely believe that we need to have a balanced view. And as a clinician who does this day in, day out, making sure that my patients are safe, and I would always consistently risk assess. To undermine my clinical work for somebody who's been doing this for over a decade is really saddening for me as well, because I keep my patients safe and I manage the risks. I discuss all the benefits as well. So this article actually is underplaying the risk benefits in regards to brain, heart and bone health as well. We are more than a sum of our collections. And yes, I agree that it's not a disease, but that doesn't mean we should manage it. There's so many things that we don't treat as a disease. Pregnancy, for example, is not a disease, but we manage it really, really well. And we have a whole field, obstetrics, set aside to manage pregnancy. Is it too much to ask that we want to manage menopause and give women what they rightfully deserve, their hormones back? Because the data time and time again has shown, and in my clinical work has shown, to be the most beneficial for my patients. So yes, let's have a balanced conversation around the risks and benefits around hormone replacement therapy. And let's make sure that we allow women to embrace the next phase of their lives, because rightly so, they deserve it. Women work so hard. But the thing that I need to make sure that everybody understands is that when it comes to the next phase of our lives, when it's menopause, that we actually invest more research into women who can't have hormone replacement therapy, such as breast cancer patients, that we have more support and educational resources in regards to the most difficult psychological symptoms around the menopause, that we have better research when it comes to dementia care for women, which are women 5 times more likely, that we have better research and access in regards to research around cardiovascular problems, and give women their hormones back. Yes, they're not estrogen deficient beings, but actually we know that that is one thing that allows their symptoms to get better, especially ones that are body identical. That's where I want to see real change, not patronizing women and saying, suck it up, love.